Welcome. My name is Susan Lieberman. I'm Vice President for International Policy with the Wildlife Conservation Society. And welcome to the second day of the event, One Planet, One Health, One Future, moving forward in a post-COVID-19 world. This event is jointly hosted by WCS and the German Federal Foreign Office. And we would like to offer our sincere and deepest gratitude, the German Federal Foreign Office, for all its support in convening and co-hosting this important conference, other colleagues in the German government, my colleagues at WCS, and of course our distinguished speakers. We have more than 600 registered participants over these 2 days, including ambassadors, ministers, other governments, intergovernmental organizations, NGOs, academics, and interested citizens. Welcome to all of you. I will not give a long presentation, but we know that the current COVID-19 pandemic has made it absolutely clear our health, well-being, and very survival are inescapably connected with the health of animals, plants, and our environment. Intact ecosystems provide the foundations for life, health, and well-being on our planet. We heard a great deal about that yesterday. We'll hear more about it today. And we heard yesterday that in order to address all of these challenges and prevent the next pandemic, there is no alternative. We must strengthen a true One Health approach. We must work on disease prevention and surveillance and monitoring, but also on biodiversity conservation. That's One Health. We welcome questions and comments from you, the participants in the chat, and our team will forward questions to the moderators of each session. But again, with more than 600 people registered, we can't answer all your questions, but we'll do our best. Today, we have 3 sessions, a session on One Health and pandemic prevention in an Asian context, then a session on the African context, and a final session on the importance of multilateralism and trans-sectoral partnerships for One Health and global health security. We hope you can join each session, but recordings will also be made available. Thank you very much. And I now turn this over to our moderator for the Asia section, Dr. Aili Kang, Executive Director of the Asia Program for the Wildlife Conservation Society. I won't read her long bio, but she completed her PhD in ecology at East China Normal University and worked on ungulate species in West China, in particularly in the Tibetan Plateau and Pamir region of China, and worked on conservation of Saiga antelope, Tibetan antelope, and Marco Polo sheep. I now turn it over to you, Aili. The floor is yours.
Thanks a lot, Sue. And I hope everyone stay well. It is really my honor to be the moderator for this Asia session of the conference. I currently have 4 guest speakers that will share their experience, knowledge, and the view about how to work under the One Health concept to address the potential challenge and the current challenge we have. And instead of myself to occupy a lot of time, I will go ahead just to introduce the first speaker, who is Mr. Stephan Opitz. He is from the KfW Development Bank. He is the member of the management committee of the KfW, and he has very interesting and decent background from the finance sector, which is very different from traditional conservation background. But this is, I think, is the key that the One Health need a different sector to work together. And I'm very happy to give the floor to Mr. Stephan to share his view under this concept.
Yeah, thank you, Aili. Thank you very much for your introduction, and I'm very glad to be able to speak today at this conference and taking the viewpoint of a development financing institution. Now, KfW Development Bank, for those who are not so familiar, is acting on behalf of the German government and implementing projects in countries worldwide with grant money or with loans. And in Asia, as well as practically all over in other countries, we are working in all these sectors that are relevant for the concept of One Health. That's biodiversity, for instance, with a large portfolio of 1.3 billion euro. And I think that makes us the largest financier in this area in the world. And large portfolios in the health sector, in agriculture, and also in water and sanitation. I could give you many examples of our work, but I think more interesting really is probably for the audience to concentrate a bit on what I think is the core of One Health, and that is the interlinkages between the different sectors, the cross-sectoral view on it. And I would like to give you 3 examples of how we are trying to enhance this interconnectivity between the different sectors that are involved in this concept of One Health. One idea or one approach is to support countries in reaching better policy coherence, between the policies within the different sectors, within the different line ministries in a given country. And that I think also relates back to the Berlin principles that were passed last year to put knowledge into policy. And one instrument that we can offer here is policy-based lending. That's not something that KfW alone does, but other DFIs too. And so, say a country commits to pass certain reforms and regulations in a given sector, and policy matrix is set up, and it is supported with advisory support by specialists in this area. And once these policies have been passed and are implemented, then the loan amount is being paid out to the budget of that government. And I could foresee, for instance, in that sphere of One Health, policy or legislation in the area of antimicrobial resistance, which is a real big challenge in the future. Or in conservation of biodiversity, that's simply management and setup of protected areas, or even the better preparedness for next pandemics to come in a given country. So that'd be one idea to really roughly talk about that. And another idea is to support better cooperation between different actors in a given field, which also relates back to the Berlin principles that ask for better coordination or work between governments, NGOs, civil society, and the local communities on the ground. And in the field of biodiversity, for instance, to give you an example, we have set up a fund, the Blue Action Fund, that is supporting the setup and better management of marine protected areas. And here the governments pay in, like the German, the French, and the Swedish government, and the best project ideas to do, a better job on marine protection by international NGOs are then rewarded with grant money. And these international NGOs, like WCF, for instance, they then work with local NGOs and with local communities, fishermen, to support them in making a better living and to practice sustainable fishery. And so we have a strong interlinkage between the different parties, the financing side, the local communities, and NGOs, which are really then have been a lot of experience in this field on the ground. Last idea that I wanted to share is better availability of data and make better use of available data. At KfW, we've been pushing this now for quite some time with different tools in order to be in a position to better prepare projects, to better monitor projects, and to quicker react to certain crises. So the idea is really to use the available data, put different layers of data on top of each other, and then analyze them, and then, for instance, allow health ministries in certain countries to react a lot quicker and more effectively to an outbreak of an infectious disease, for instance. So these are really, quickly sharing 3 ideas on, on concentrating more on the kind of interlinkages between the different sectors in this sphere of One Health, to allow for a more holistic approach and an approach that is more adapted to local environment, and together with different parties to get all the know-how really into the picture. Thank you.
Mute. Aili, you're on mute.
Sorry, it's still my technical issues. Thanks a lot, Ms. Stephan. I just want to highlight, as you mentioned, critical, the interagency collaboration and also different sector collaboration is very important and critical. May I ask from finance sector, and as a person for the bank for many years, what kind of challenge you will see for this type of collaboration between conservation sector, development sector, and the government sector? From your view at the finance level, what will be the major challenge?
Well, a big challenge in the field of protecting biodiversity is surely that a lot of projects are not, well, so to say, credit-worthy. So the protected projects, protecting biodiversity are mostly financed through grant money, and here, we have to be very, very careful to use the money wisely because it's grant money, and so this is why I've highlighted these approaches of where you get, as with the Blue Action Fund, where you get different parties involved. And get this know-how together to really use the scarce resource of grant money most effectively. The way forward maybe in some of these areas is that through ecosystem-based approaches, maybe in the future some of these projects can also generate a certain return and maybe even be able to to be financed through loans in the future.
Thanks a lot, Mr. Stephan. Now I would like to introduce our second speaker, but before I do that, I want to say in the beginning, I forgot to mention, we also have 2 videos. One is from Indonesia, and the other is from Asia, WHO Asia Program Coordinator. Because of the technical issues, we could not do that video now during the whole session, but we will put that into the recorded program so you will see. I apologize for the technical issues at the moment. So I will go to the second speaker, who is Professor Tianbao. He is from China, and he is a leading person, one of the leading experts for the legislation within China related to environment. And he has more than 20 years experience on that. He is one of the key participants to help to draft the new biosecurity law in China, which for me, I think is a amazing and a very critical law at this moment to move forward. But on the other side, Professor Qin involved different type of environmental law, not only just one type. So I would like to give the floor to Professor Qin to share his view from legislation expertise side.
Thank you very much, Ms. Aili Kang, and thank you so much for the kind invitation by the WCS and the German government. I'd like to share my understanding about the latest development of China's legislation. Actually, this is how China's new legislation to integrate, I mean, the concern of public health into the new biosecurity law and the ongoing wildlife protection law. So everybody knows that since the outbreak of this COVID-19, and the public health is was a central topic actually, not only in China but also in the whole world. So Chinese legislature started to bring the concern into the legal progress. So one of the achievement is the new enacted biosecurity law, which is actually will be the law just was just passed, will enter into force next April. So after that, this law will be the most important legal instrument to guide the integration of public health with the biotechnology development and research, and also with several other aspects. The first important point is that the public health has been incorporated into the legislative purpose. So Article 1 of this law clearly states that the purpose of this law is to safeguard the life and health of the people, and among others. And in addition, that the precautionary principle is dominant principle of this this legislation. That means even we do not have a certain scientific certainty on the interrelationship between the wildlife or the bio issues with the public health, the Chinese government still will take some cost-effective measures to prevent the possible disease caused by the wildlife. For this purpose, the Chinese biosecurity law actually has established almost 11 systems. For example, the monitoring and early warning system, and the risk investigation and assessment, and the information sharing system, and the information release system, and a coordination and connected biosecurity standard system. So I remember that just now that Stephan mentioned the holistic approach. So this biosecurity actually carried out this, employed this approach very well, actually. Try to use kind of a holistic approach to integrate the public health and the technology development and research, and the GMO and several other issues altogether. So this law, for example, they also have some emergency response system and several other supporting system to this public health concern. Another important point is that the among others, the law, the biosecurity law, has a very special chapter on the public health and eco health issues. So I mean, that means the whole chapter actually provide the legal basis on how to guide the how to protect the public health in the context of biosecurity. In addition to this, chapter 3, all other chapters also provide several legal grounds for integrating of public health with biosecurity situation. Another important development is the wildlife protection law. So even till now, we do not have a certain scientific evidence to show that the COVID-19 is caused by the wildlife, but we have already several, actually majority of scientific evidence, but we cannot say 100%. But in February, actually, the Chinese government, the Chinese legislature, the parliament has published an interim ban of the eating of the wildlife, use the wildlife as food, and for the purpose of the life and health of the general public. And following this ban, this ban actually is not a law. It's a decision by the legislature, by the parliament. So following the spirit of this ban, the Chinese parliament actually started the revision of the wildlife protection law. So now is the first reading has provided, and when we read this, the first reading revision of this new wildlife law, we can see also in the Article 1 in the legislative purpose, to prevent the public health risk is the very important purpose among the others. For example, to protect the wildlife itself, to protect the eco security, to conserve the biosecurity, biological diversity. So you can see the law also incorporated the approach of a holistic approach. Also for this purpose, this law extended the scope of wildlife regulation and get rid of the bad habits of overeating of wildlife animal, and resolutely ban and crack down on the illegal market trade, and increase the penalty for violations, and it also have several other developments. So this, according to Chinese legislative process, this law will undergo 3 readings. This is the first one. Now the legislature has called for the public comments. So tomorrow is the deadline for the first call for comments. But we still have opportunities for the second reading, for the third reading. So I believe this new wildlife protection law will incorporate the concern of the public health. So this is only 2 very typical legislation. We have also several others. For example, the quantitative law, and the public health law, and several other laws. So we can say we have the biosecurity law as a core. We have a legal body actually to try to bring the concern of public health into the existing biosecurity law, wildlife law, and I think this kind of a legal approach or legal practice could provide incentives for the purpose of our health. So that's my very short presentation. Thank you.
Thanks a lot, Professor Qin. May I just ask one question? In the biosecurity law, there's quite a big component is talking about data sharing, or say to develop a national level database to facilitate more communication, information exchange between different sectors. How the law makers try to coordinate between different agencies to agree on this multiple agency database or kind of system to move forward? How many agencies that engage in the discussion of those and the coordination? Do you know?
Oh, yes. One lesson, one of the major lessons we learned from this COVID-19 is that the fragmentation of information and the not very coordination among different agencies. So that's one of the main purpose of this this law is provide a holistic and coordinated leadership and mechanisms, and try to bring all relevant organs and ministries into integrated way of decision making. So data sharing is one of the main components for this purpose. So according to this law, the China will establish a uniform platform, the technical platform, and try to connect all the existing database data bank or several other existing information sources. And or we will add some new elements into the uniform platform. Because the biosecurity law actually covers very broad areas. As more than 10 or 15 agencies have been included. For example, the Ministry of Agriculture, Ministry of the Public Health, Ministry of Science and Technology, Ministry of the Environment, Ministry of not Ministry of State Forest Agency, and so on. So all relevant ministries with the biosecurity will be included into the new coordinated mechanism and the platform.
Thanks a lot, Professor Ching. So now I move to the third speaker, Dr. Enkee Shiilegdamba. She is one of my best colleague and friend within Wildlife Conservation Society. She is a country director of our Mongolia program. And she had more than 20 years for the agricultural veterinary background. And the first 10 years working more for the livestock, but then moved to the wildlife component. So that's give her a very unique position to look into the both livestock and the wildlife, and how the zoonotic disease linkage between those. It's not just one direction, it's a two-direction problem. And this is why One Health is very important. And I would like to give the time for Enkee to share her unique experience in Mongolia.
Aili, thank you very much. It is an honor to present tonight at the Asia context, and especially representing One Health approach, what we have done in Mongolia. So I have about 5-minute presentation that I want to share. I hope screen sharing. I think I am disabled to screen sharing.
You should be able to.
Okay, now I think I'm able to. So as Aili introduced, I will be talking more of a One Health approach in Mongolia. And so what WCS Mongolia have established on One Health frontline. So mostly we are field-based ecology, disease, and research-based organization on wildlife habitats. And therefore, we are in the front lines to respond to wildlife-related pandemics or outbreaks and mass mortalities. So Mongolia have experienced wild bird mass mortalities just following the Qinghai outbreak in 2005. And WCS have been able to establish a One Health surveillance on wild bird avian influenza surveillance over the past 15 years, funded by various agencies and lastly by USAID. And we also had the unique opportunity to respond to PPR, which is the Pistidipetis ruminans, a goat plague outbreak surveillance system in Saiga Antelopes. And most recently, we have been funded by BMU in establishing a local multi-agency based surveillance system. What Mongolia needs and lacks at this point is a national One Health surveillance system, including wildlife and environmental sector. There is a human health and veterinary sector incorporated One Health system, but latest examples of COVID and PPR in Saiga Antelopes, and we see the importance of wildlife health and incorporation of this into national systems. So PPR surveillance system in Saiga was established due to the Pistidipetis ruminans. It's abbreviated as PPR, which is a goat plague disease that devastated the Mongolian Saiga population. It was a livestock disease spillover from sheep and goats to the wildlife, such as the Saiga. And first detection of mass mortality in Saiga was observed in December 2016. The Mongolian government spent almost 3 weeks trying to strategize and get ready for the response to wildlife mass mortality. This is mainly due to the lack of wildlife health agency in Mongolia. This is non-existing at national nor at local levels. So WCS played a key role in leading wildlife disease expertise, providing knowledge and support to government on decision-making and on management actions. And based on that, WCS is building One Health field surveillance teams among local veterinarians, rangers, zoonotic diseases, so Mongolia can be ready during the next outbreaks or mass mortalities of wildlife. From this graph, I want to show you that Mongolian Saiga are only existing, it is a subspecies of Saiga and only existing in Western Mongolia. The blue represents the current range of Saiga, and it's yellow or in grayish, it's representing the historic site of Mongolian Saiga. So its historic range has decreased almost by 80%. And the population is already struggling and shrinking. On top of that, having the PPR outbreak hitting the end, leading to mortality of more than 80% of the population was a huge devastation to Mongolia. It not only impacted Mongolian Saiga. From this, you can see on the bottom, goiter gazelle, Siberian ibex were largely hit next to the Mongolian Saiga by this PPR outbreak, as well as Argali sheep. And you can see that in the global level, there are multiple wildlife species being detected by PPR. And this is a global pandemic moving from Africa to Middle East to Central Asia and farther on. And you can see that Central Asia is the last intact habitat of mass biodiversity in Asia. And we have to be upfront and protecting this biodiversity. So what we learned from all this avian influenza PPR-based surveillance and mass mortality outbreak is a holistic One Health approach. Partnering with key global and national organizations is key, but this approach has to be bottom up. And where we start for the conservation of Saiga is working with the people, local herders, local communities who need to be educated, informed, and be vigilant to report the first suspicions of the outbreak, whether it's in their livestock or in wildlife. And then we also working with local expertise, veterinary, protected area, environmental, and zoonotic disease expertise to be knowledge in wildlife, to be prepared on how to collect samples from wildlife and how to report, how to collect important epidemiological information. And that knowledge can be shared at national and international levels among the expertise of PPR or One Health experts. That knowledge can be further fed into global and national policies and practices that will be multidisciplinary and cross-sectoral, and which can be easily informed and implemented by local people and local expertise. So we find this is a key to One Health approach, holistic One Health. Also, in conclusion, I want to highlight that exploitation of natural systems are real and leading to environmental stress. Increases in livestock population, intensity of livestock farming, such as 70 million livestock in Mongolia, are intensifying wildlife, livestock, and human interactions, thus increasing zoonotic disease risks. Increased climate change impacts are causing environmental stress as well, such as extreme heats, drying of the steppe, heavy winters, which we call zuds, are reoccurring regularly. PPR and transboundary animal diseases have no human health risk, but it causes a large food safety, security, and livelihood risks. According to FAO OIE, PPR causes 2.1 billion economic loss, impacting over 300 million rural families globally. And pandemics can lead to biodiversity loss, and we see this. And the first example of mass mortality in Mongolia was due to the Saiga antelopes. And we have experienced in Kazakhstan, there were mass mortalities of Saiga as well. So bottom-up One Health approach can be the foundation for One Health that is inclusive of One Health and can secure the future for all. So this was a brief presentation, and I'm happy to answer any questions. Thank you very much.
Thanks, Enkee. I will just take advantage to raise the first question to you. The whole approach in Mongolia, I noticed one key component is work with local community very closely and try to encourage them to participate into this whole approach. And how you think about their role, how you think the community can further engage into those One Health approach compared to government sector, NGO sector?
Yes, so unfortunately, government, due to our policy support and such, there is now an animal health law, which incorporates livestock health and wildlife health. And although there is a law, there is no, the law doesn't have legs, which means it doesn't, there is no system in place to inform the local people to actually implement and follow the laws. So NGOs play important and critical role to government to be those legs, to be the arms, to reach out to the communities and the people where this biodiversity is, and where there is high interaction, where there is competition for resources between wildlife and livestock, and where there is need to be educated and start acting at the front line where the herders and the communities are fighting with biodiversity. We have to stop that fight. We have to bring the people. Mongolians have been for generations environmentally positive people because of our beliefs and ancestors' teachings. That's why Mongolia is intact, has large intact grasslands, rich biodiversity. But we are at the edge of intensified farming, exploitation of lands, exploitation of minings, at the edge of breaking that that knowledge and that inheritance and culture. And we have to act now, and that's where NGOs play critical role.
Thanks, Enkee. Now I would like to introduce Dr. Amanda Fine. She is the Associated Director of the Health Program of Wildlife Conservation Society. She has also more than 20 years experience in the veterinary and also wildlife health. And her footprint is covered from Mongolia to the Southeast Asia, such as Laos, Cambodia, and especially Vietnam. And her work, not only technical level, but also try to encourage different agencies from WHO, FAO, and different government agencies to work together to address the zoonotic disease. So the floor is yours, Amanda.
Well, good morning, good afternoon, and good evening, everyone. It's great to know that so many friends and colleagues and family are watching tonight and to be amongst so many concerned citizens. I do have a presentation that I've put together for all of you. I will share my screen. And as Aili has said in her introduction, I am joining you tonight from Hanoi, Vietnam. It is really my pleasure to share with you the efforts to operationalize One Health in Vietnam, especially in the context of the COVID-19 pandemic we are all experiencing today. So what makes Vietnam distinct globally today at this moment is its incredible success in containing COVID-19. It is amongst, has one of the lowest numbers of cases per 1 million and has very successfully contained the virus. Vietnam is also known as one of the countries, as is much of tropical Asia, as being considered a hotspot for infectious disease emergence. And we feel that the success Vietnam has had in controlling COVID-19 is really a signal of the potential for Vietnam to also take that strong national leadership and the multi-sectoral coordination they have brought to bear on COVID-19 to also lead the region and take action to prevent future pandemics. Critical to Vietnam's success was its early action and its focus on mobilizing all sectors to fight the outbreak, with this focus on protecting the health and lives of its people. What was significant was the Prime Minister's directive in late January of 2020, which included the prohibition of wildlife trade as a component of the immediate action required to face the outbreak, placing the banning of wildlife trade alongside key public health interventions to stop the spread of the disease. The closing initially of the borders with China, canceling of large events, schools, universities all going online, health checks put in place, medical declarations on entry, strong leadership, building multi-sectoral response, but including from the very beginning, addressing the wildlife trade and implementing an initial ban in the face of the outbreak on wildlife trade. This opened what I think one of the presenters yesterday in the Latin America section coined a pocket of possibility. It really provided an opportunity to emphasize what we're all here together today to talk about, which is this one planet, one health, one future approach. And it gave the conservation opportunity, the conservation community, an opportunity to follow up and take action. An open letter to the Prime Minister of Vietnam was sent by a group of conservation NGOs, both local and international, with an emphasis on sending a joint open letter and sending it not to the line ministries, but directly to the Prime Minister, asking essentially that that initial ban on wildlife trade be continued. And it called for immediate actions to address the illegal wildlife trade in the context of COVID-19 and this current pandemic, but also spoke to preventing future pandemics. That call of action of the NGO community had great public support, as evidenced by the response in the local media. It also resulted in a direct response from the Prime Minister of Vietnam. The letter was responded to, and then in March, the Prime Minister of Vietnam directed the Ministry of Agriculture and Rural Development, under which forestry as well as animal health is housed, to coordinate with other relevant ministries to draft a directive to, quote, prohibit the trade and consumption of wildlife. This was initially applauded by the public, the news in the press was that Vietnam was going to ban the trade following conservationist demands. This was, it was true in the sense that we had a very strong response from the Prime Minister, but what happened with the directive was that initial entry point to say this is important and direction to the line ministries to draft a directive. As the drafting of the directive moved through government, we as WCS and other partners that have been directly involved both in wildlife trafficking, counter wildlife trafficking work, and preventing pandemics and understanding the drivers of disease emergence, work together to mobilize One Health partners in Vietnam to urgently harmonize our goals and really prepare to take action to support the government of Vietnam in addressing wildlife trade and consumption as a specific step to pandemic prevention. The Pandemic Prevention Task Force, as we've called this informal group, was formed as we gathered at the One UN House in Hanoi, very appropriately with the backdrop of the Sustainable Development Goals. And we really grappled with how specifically we could stop wildlife trade and consumption and the destruction of nature to end pandemics. And how could we effectively support the reduction of that risk of emergence of viruses of pandemic potential? Key partners, as I said, included those that have been engaged in both biodiversity conservation as well as broader public health issues in Vietnam for many years. Government support from the US and Germany, very strong. The conservation NGOs then joining with the main UN agencies, primarily supported by FAO, as well as WHO, the UN Environment Program, and the UNODC. We spent quite a bit of time reviewing the wildlife supply chain in Vietnam, with the wildlife conservation NGOs providing key information on the trade itself, but also the current legislative framework for the control and regulation of wildlife trade in Vietnam and key opportunities for reform. This was critical information that the broader public health community does not have, and it provided the opportunity to really explore together what the possibilities were moving forward. We also spent considerable time reviewing the evidence of viral spillover risk along the wildlife supply chain and those key interfaces or contact points between wildlife and humans where viral spillover can occur. We consider the results of studies that have been conducted here in Vietnam with government partners, including this one that is depicted here, both in illustration as well as the graph, which was a study on coronavirus detection rates along the live rodent supply chain in Vietnam. This was conducted by WCS with colleagues under the USAID-funded Emerging Pandemic Threats Program project. And it illustrates here, as we go from sampling rodents that are at the point of the trapper and trader, we had 18% of the samples that were positive for a coronavirus. As we moved into large markets, that increased significantly to 32. And then as we sampled in restaurants at that end consumer, greater than 50% of the samples were positive for a coronavirus. These were rodent coronaviruses, but it gives you an idea and gave this group an idea of the background risk that is there. And it also helped to illustrate and also understand the process that the study illustrates in terms of the amplification of risk along the supply chain as wildlife has moved out of its natural environment into human-dominated landscapes. There's that increase in contact rates, that potential for cross-species viral transmission, co-infection, and the kind of recombination that can lead to the emergence of a new disease. So the Pandemic Prevention Task Force, as we have called this broad group that invites other partners, met frequently and had a lot of very constructive dialogue. My thanks goes out to all of the individuals and their organizations represented that contributed and continue to contribute to this conversation in Vietnam. We were able to identify a clear and harmonized goal for action to prevent the next pandemic by focusing on ending the commercial trade in consumption of wild birds and wild mammals in Vietnam. This is to further the Prime Minister's directive, which did come out in July of 2020, which calls for enforcement of existing wildlife trade laws and maintains some limitation on wildlife import. It leaves the door open for further risk assessment and further legislative reform, like the reforms that we've heard about from my panelist colleague from China that have gone forward and have moved into the National Assembly in China. We think it's incredibly important to develop and strengthen and enforce all the legal measures that will be required to phase out the commercial trade and consumption of wild birds and mammals to effectively support that reduction of spillover risk. And we also feel that the establishment of a high-level multi-sectoral authority will be critical, both to coordinate, also to ensure the resources and provide that accountability across the ministries. So we do have that One Health outcome that we all are aspiring to. And I will stop sharing my screen there. I'd just like to conclude by saying that there is very much work to be done. There's still a lot of work to be done, but I am optimistic here in Vietnam and the broader Asia region that the right critical first steps have been made, allowing us to really at least move forward in step with the One Planet, One Health, One Future movement in a post-COVID-19 world, and hopefully with continued support from this community. Thank you.
Thanks a lot, Amanda. I think your conclusion actually is what I want to question, so you already have that. Since the time is almost there, we have just another 5 minutes. I think, unfortunately, we don't have a lot of time for the Q&A. I think that you all, if there's one or two questions want to highlight, I think there's one question I just want to ask every speaker to think about and emphasize only one question. How public, how different people, individual can engage in this One Health? When we're talking about government sector, finance sector, it seems that the room for individual or for public to engage and to involve hasn't been really emphasized. It's from legislation to the implementation. So there's several questions actually from the audience is try to talking about that, but given the time is short, I want to just summarize the key idea and want to see if any of the speaker want to give just one sentence or two about how individual public can participate.
I'll say just a couple words, Aili. I think it's really important that we continue to have conversations and identify action that can be taken no matter who you are and what your role in society. We are all broadly consumers, and I think recognizing that that needs to change, and we need to respect the biodiversity and the planet that underpins health broadly. So I think there's really, I didn't spend a lot of time talking about the dialogue we've had here in Vietnam about how we reach the public, but I think there is already a lot of discussion on the street about how we all change and really taking advantage of this opportunity to promote that further thinking and further action.
Thanks a lot. Any speaker, last minute, about the participants of the public engagement? May I ask Professor Qing, because you're from legislation, and actually you talking about public discipline. So any one sentence to encourage our audience?
Oh, thank you. I noticed that there's a question about the public interest litigation. Sure, this is a very useful tool to use as a kind of public interest litigation to reverse the current situation. I mean, this the people are not so care about the wildlife or care about the public health concern of this wildlife. Anyway, the law is a very useful tool to guide people's behavior. And but law is not the only one, not the it cannot solve all the problems. So Venice reason and several other activities are also useful to promote the general public for this purpose.
Thanks a lot.
And thank you to all of you, and thank you tremendously to the presenters in this session. We are now going to give you a very short 5-minute break to you participants, so we can switch over to the Africa session. But again, thank you very much for all of the really interesting and rich discussion from an Asia perspective. The tape of this will be available probably the first week of December. Thank you.